Wall Street Journal recently reported that companies unwilling to require employees to get vaccinations are increasingly considering healthcare benefit surcharges. I think one airline is working on this,
right,
and other more aggressive measures to make their workplaces safer from COVID.
Well, Paul Siegert is the managing partner at PCS Advisers, which is an employee benefits company. Good morning, Paul.
Good morning. How are you today?
Doing good. So we've seen companies ask, plead, bribe, and now they seem to be done. Is that true?
That's right. Yeah, we have some. If you look at just the airline industry as an example, you've got some that are coming out saying we will continue to not only encourage, that would be airlines like Southwest and American, and then you have others who have gone all the way to mandates requiring vaccination. With some small exceptions and accommodations, that would be United and Hawaiian. And then Delta's choice has been, which I think will be increasingly popular amongst employers, is to impose a surcharge, $200 a month of additional payroll deduction if you choose not to get vaccinated against COVID.
Okay, so what do you say to an employee who says, and we've heard this, my body, my choice, and why should it cost me more? This isn't fair. What do you say to that employee?
Well, the mandates will likely hold up and the surcharges, because of the fact that an employee can choose to go work somewhere else. I know that's not always an easy thing to do, but legally, from an employment law standpoint, employers, even before Pfizer got the official approval for their vaccine, they had the legal right to do this kind of thing, and there is precedent for it. I think there are some interesting lawsuits, however, that could change some of these policies relating to natural immunity. There's a UC Irvine professor, a doctor, in fact, who's suing the UC system, and another law professor at George Mason University who claim that their natural immunity should be an exception to the vaccine requirement. And I think that could stand up. There are plenty of studies that do support that fact. So we're watching those closely, but I don't think they'll lead to doing away with either the surcharges or the mandates. Those are likely here to stay and will probably grow.
So, during COVID, we saw a lot of people starting to work from home. What if you were an employee, you don't want to get the vaccine, you want to work from home? You're not a danger to your other coworkers if you're not going to work, so isn't that a possibility?
Yeah, some employers are making that available. Some in the tech industry have already said if you'd like to come back to the campus, you'll need to show proof of vaccination, or you can continue to work remotely.
Do you think at some point that people could get fired for not taking the vaccine?
Yeah, there already have been cases. There was a hospital system in Houston, and they went to the hard line and said you have to get vaccinated, show proof of vaccination, or work elsewhere. And I think they had 153 nurses and other staff resign the day that went into effect, which brings up a whole another pretty interesting part of the conversation. I think the bigger factor in whether employers choose to go down one of these roads will be how it will affect their culture. Will they make their company an undesirable place to work? Will they, frankly, just not be able to staff their facility? Ironically, the healthcare industry is one where that could happen. They were under shortages prior to the pandemic, and now I've talked to hospital CEOs and some other clients that have said they're just flat afraid to put in a mandate or even a surcharge because they could end up being incapable of staffing their facility.
Well, it'll be interesting to see what happens in the next couple of months. Paul Siegert, managing partner at PCS Advisers, thank you so much.
Thanks for having me. Have a great day.